Hello, and welcome to the Kansas State Veterinary Diagnostic Lab YouTube channel. In this video, we will demonstrate liver biopsy in the bovine using the SurgiVet 14-gauge biopsy needle. Before you begin, familiarize yourself with the biopsy needle. First, pull back on the handle until you hear a click and it stays in place. This loads the needle for the biopsy procedure. Next, observe how gently pushing the inner stylet forward until resistance is felt opens the biopsy trough. This is done after you penetrate the liver. Next, observe how putting pressure on the handle causes the outer needle to snap shut, capturing the biopsy in the trough. After this step, the biopsy needle is ready to remove from the animal without further action. To begin, restrain cattle as needed. Do not squeeze the animal in the chute, as this will change the location of the liver. If the animal is fractious, move on to the next one. Landmarks. Draw a line from the tubercocci, or the hook, to the elbow of the calf, and from the hook to the shoulder for a cow. The site for the biopsy will be at the intersection of this line with the 10th intercostal space. This is approximately 1/3 of the way down from the top line of the animal to the ventral abdomen. Clip the hair at least 2 to 4 inches from center of the landmark with a number 40 or number 10 clipper blades. Inject 5 to 10 ml of lidocaine subcutaneously and intramuscularly with an 18-gauge 1-inch needle approximately an inch surrounding the biopsy location. Allow at least 5 minutes prior to biopsy after the lidocaine injection before starting the biopsy procedure. Scrub the clipped area with betadine several times. Spray or wipe with isopropyl alcohol. Make a stab incision with a scalpel blade completely through the dermis. Try to stay in the middle of the intercostal space, but certainly avoid the caudal portion of the 10th rib. Aseptically prepare the spring-loaded biopsy needle. Load the spring-loaded biopsy needle by pulling on the stylet until you hear a click and it stays in place. Insert the biopsy needle through the incision and intercostal muscles to about 1 inch and stop. Redirect the biopsy needle parallel to the ground and slightly forward towards the left shoulder of the animal. Gently advance the biopsy needle another 1 to 2 centimeters until a pop is felt and stop. This indicates you have penetrated the liver capsule. The total distance of penetration is 1 to 2 inches in most adult cows and 1/2 inch to 1.5 inches in calves. Once the capsule is penetrated, slide the inner stylet forward to open the notch by pushing the spring-loaded handle forward until there is slight resistance. Do not push it all the way. Push the trigger of the biopsy needle forward until a click is heard. The outside cutting portion will slide over the notch, collecting the liver. Quickly retract the biopsy needle. Once the biopsy needle is fully removed, pull back the spring-loaded handle until a click is heard. Reveal the notch that contains the liver biopsy sample by pushing the spring-loaded handle forward. Remove the biopsy sample using a hypodermic needle and place it into a royal blue plastic falcon tube or conical snap cap tube. Remember, do not use a red top tube. Place the biopsy sample onto the side of the tube and let the sample dry in place. Do not add saline or fluid to the tube with the biopsy sample. Repeat steps 1 through 10 as necessary if a full trough of tissue was not acquired. Glue or suture the stab incision if needed. Apply antibacterial ointment if needed. Samples should be shipped with ice packs for overnight or 2-day delivery. If overnight or 2-day delivery is not possible, freezing the sample until shipping is acceptable. For more information on this procedure or any other tests we offer, contact Client Care.